Wonderful. Let's get started. I want to introduce myself. My name is Taryn. I'm one of the knowledge and research leads here at the Center for Innovation in Campus Mental Health. Welcome to our March webinar. We are joined by a great set of folks here to talk about Talk Today program at Brock University. Before we get started, I do want to do our land acknowledgement. So even though we are here virtually, we are joining in from ancestral lands of many Indigenous communities. I am currently in Toronto, Treaty 13 territory, and the home of the Anishinaabe, Haudenosaunee, Wendat peoples, the Mississaugas of the Credit, the Chippewa, and people who may still be unrecorded. As we go through this webinar, I want you to think about how you might be able to support Indigenous students and colleagues in your role to promote a whole campus approach to health and wellness, and also be an active participant in the reconciliation process. This can look like a lot of things. It can look like participating in education on Indigenous peoples, their culture, language, arts, worldviews, and supporting organizations that help Indigenous communities. So before we get started, I do want to go through a few housekeeping. Closed captioning is at the bottom of the screen. You're welcome to turn it on if you would like. The chat function is available for discussing thoughts and reactions, and if you have any questions, you can add it there as well. But we encourage you to use our Q&A function for questions, as we will be going through questions at the end of the webinar. Recording will be available by the end of the day on our website on campusmentalhealth.ca. Without further ado, we'll get started. I do want to turn it over to our speakers to introduce themselves. Maybe we'll get started with Alex.
Thank you so much, Taryn, and really excited to be here. My name is Alex Salomie. I'm the Talk Today Program and Communications Manager with the Canadian Mental Health Association Ontario Division, and my role is to help support my colleagues across the country in implementing our Talk Today program in various communities.
Wonderful. Philip, I'm going to turn it over to you.
Okay, thanks. Great to be here. Really looking forward to the talk. My name is Phil Sullivan. I'm a professor in the Department of Kinesiology at Brock University. I'll talk about my role with the project as we get into it. As a field of study, I'm a sports psychologist with a major interest in the mental health of athletes.
Wonderful. And then I'm going to turn it over to you, Mishka.
Sorry to join late there. There's a bit of an issue with my Wi-Fi, but happy to be here. My name's Mishka Blacker, and I've been at Brock since 2015. I'm a PhD student here, and I research in the area of sports psychology, mental toughness, and athlete mental health. And super excited to be part of this project. I can't believe it's been this long and we're at the end, and so happy to talk about it with you today.
Wonderful. And I'm going to turn it over to you, Heather.
Hi, I'm Heather Gillespie. I'm the Director of Clinical Operations at CMHA Niagara and a partner in this research project.
And then over to you, Jenny.
Hi, everybody. Happy to be here as well. I echo Mishka in saying that I can't believe we're finally here. And I just wanted to tell you that I am a student wellness and accessibility coordinator at the university.
Wonderful. And then finally, Josh.
I'm Josh Celebry. I'm in a similar position as Mishka, so I'm a second-year PhD student at Brock University. My research interests are in the realm of sports psychology, but specifically athlete mental health.
Wonderful. Okay. And then I'll turn it over to our speakers here. Alex, we're welcome to share the slide. Let me know if you have any issues.
Perfect. I'll share it right now. Taryn, can you see my slides? Awesome.
Yep.
So really excited to be here. This has been an incredibly unique opportunity for us on the Talk Today program, and it's one that we're very passionate about and very excited to share with the CICMH community in particular, we wanted to kind of give a brief overview of what the program is before I kick it over to my colleagues who are going to go into more detail about some of the work that they did this past year on our pilot and talk a little bit in more detail about their roles and the impact that they've been able to have on the project. So to give a high-level overview of what Talk Today is, we are one of the most comprehensive sport mental health programs in Canada. What started as a pilot with the Ontario Hockey League in 2014 has grown to become a national program for us here at CMHA Ontario, and has been scaled to support the two highest levels of junior hockey, along with various other sports partners and organizations across the country. We've also been working with post-secondary institutions in the past, but our most recent pilot with Brock has been a particularly unique experience, especially when we get into some of the work that Philip and his team have been doing, as well as some of the unique cross promotion and cross support that we've been able to do between our community work and our and the local campus supports. Diving into a little bit more detail on the Talk Today program itself. So the program is built around three core components. We do education for athletes and those around the athletes, so coaches, trainers, any additional individuals who work with the teams. We provide support for athletes if they're struggling with their mental health, and we raise awareness within the community. So when we talk about education, the core education component that we focus on is suicide prevention and mental health awareness. It's been a core component of the program since 2014, and this particular year we were able to pilot a new training that we had originally developed for our hockey partners with a post-secondary audience, and we're really looking forward to sharing some of the results and hearing some of the results that Philip and his team have received on that. But it's a unique opportunity where we've developed an athlete-specific training that has helped encourage athletes to better understand suicide and suicide prevention strategies, as well as creating a more positive atmosphere in the locker room for them to feel comfortable talking about their mental health and engaging with their teammates if they feel like someone might be struggling. One key element of the education component is that all athletes do have to participate, because that's how we drive a lot of the that comfortability in the locker room and make them more comfortable in the locker room having these conversations. And they all come out of these trainings with a shared message and communication strategy when they're looking at having those conversations amongst themselves or with others that they may know. The support component is another core component of the program, and this was something when we initially developed the program we saw as highly important, because it's one thing to go in and provide education, but when you step away from that team, well, what do they do if they need support, and where do they go, and who can they access? And this is where a lot of the heavy lifting at the local level, particularly with my colleagues at our branches and with the campus supports that are available, gets done. Because if an athlete is seeking support, they have a direct contact that they can go to get more information and figure out how they can access the best supports that'll suit their needs, whether they're struggling with anxiety or addictions or a different type of issue, whether even suicidal ideation. The idea here is to make sure that the person who they're reaching out to has the information necessary to guide them to the best support and provide that warm handoff to a direct resource that'll address the issues that they may need support for. This component is also a little bit different in the campus context than in some of our partnerships with sporting organizations, because campuses, and Brock in particular, has the particular opportunity and resources available to have someone within the campus context who has an expertise in this area and can have these conversations with students. With other organizations, what we do is we develop what we call a mental health champion role, where somebody within the team is sort of designated as a go-to person. So they'll have a community contact within our CMHA branch and somebody within the team who would be a go-to person if a player's struggling and they're not comfortable, or they want a warm handoff to the community CMHA representative. That mental health champion within the team would serve in that purpose. And then the final part of our work with the Talk Today program, the third component, is awareness. And this is really big because athletes in particular have a very important platform, and a lot of people look up to and respect athletes and within the community. And the awareness events play an important role in driving more awareness around mental health, destigmatizing conversations around mental health, and using that platform that these athletes have to promote positive mental health, both on campus in this case, and within the community where possible. And what our awareness events usually look like, we've got a great photo from the one we did with our folks at Brock, but generally there's a lot of different components that can get built in, and it's catered to the specific sport or event that we're looking to host. It could be booths, it could be local media announcements. In cases where there's audiovisual content, we can use video boards and so on to promote the partnership. And really we try to utilize as many resources as possible to really highlight the work that we're doing and our partnership through the Talk Today program. So that's a little bit about the Talk Today program. I'm going to jump quickly into a little bit about our Brock pilot, and then I'll pass it over to our folks to speak about some of the work that they're doing. So the Brock pilot itself actually began as part of a MyTax research grant between Dr. Sullivan and his team and CMHA Ontario, and Heather and her team at CMHA Niagara. And this is a really unique way to bring Talk Today to a post-secondary institution, because it gives us the opportunity to not just implement the program, but also get feedback back and have supports resources available to better understand how the program is impacting the athletes that we're working with. And this was, and we were really excited. I've been working with Philip for a number of years now, and we actually had our initial connection through the Center for Innovation in Campus and Mental Health. So our initial connection came through CICMH, and it's almost kind of perfect that we're here speaking at this webinar a few years later about the work that we've been able to do together. So really excited to hear some of his results. And then following the approval of the research grant, what we ended up doing is we started working with Jenny and her team at SWAC, the Student Wellness and Accessibility Center, and Brock Athletics to provide the internal resources to support the success of the program. Because certainly without buy-in from Brock Athletics and the folks at SWAC, it would have been incredibly difficult to get this program off the ground, and we really appreciate all the support we've gotten from them as well. So I'll pass it over to the research team to chat a little bit more about their involvement and work in the program.
All right, thanks, Alex. So Mishka and Josh are here and have introduced themselves, and as a group, we've definitely got a strong interest in mental health of student athletes. I mean, they're a very specific population. They got very specific demands on their mental health and very specific barriers to help seeking. So we've been doing stuff with that for a couple of years. Mishka and Josh have already both introduced themselves. They've been at Brock for, Josh has been at Brock for, I think, 7 years now. Mishka's, I think, probably about 6. So we've done a lot of work. And the opportunity for this partnership with CMHA, particularly with the MyTax, was really, really beneficial, because the MyTax is a funding agency, a federal funding agency that funds partnerships between universities and community programs or industry, and it was able to support Josh and Mishka to work basically as coordinators and research assistants for this program. Can I control the slides, Alex? You want to go to the next slide? So I think the next one's about Brock Sports, and I can talk a little bit about this too. So we had, from the get-go, we had great buy-in from Brock Sports, top-down buy-in, which was excellent. The program that we'll talk about, I mean, I'll talk about it. I'll kind of complement Alex's talk, where I'll talk about it more as a research program, because what we wanted to do, and the whole purpose of the MyTax grant, was to provide evidence for how effective this might be in a pilot study, a relatively limited pilot study. With that in mind, I mean, Alex talked about the great support and the connections we had with the service providers at Brock, but Brock Sports and Brock Athletics definitely had to get on board. Melissa Christ is the director of Brock Sports and has always been extremely supportive of this. When we laid out the feasibility and the pragmatics of doing this program, she fully supported it, went back to Brock Sports, came back to us with a couple of teams that she knew were a good fit for the program, that had the right leadership in terms of their coaches, that would, be quite interested and quite motivated to participate in this project. So with her assistance, then we identified 2 varsity sports. Each sport had a men's and women's team. And so all 4 teams participated in this, approximately 70 student athletes. The coach was definitely involved throughout the program. They were the main linkage with respect to any kind of communication that we wanted to have with the team, or feedback that we needed to get in terms of structuring things, scheduling things. So it was, in terms of an institutional buy-in from Brock Sports, it was fantastic. It was really, really well supported. What we'll see then is we've got the approximately 70 student athletes, half male, half female, half one sport, half the other. In each sport, one team participated in Talk Today, and one team was kind of a control group that did not participate, but had the opportunity, if they wanted to participate in Talk Today at a later point in time, we will follow up with. And even though Brock Sports and Melissa and their coaches identified and supported reaching out to these teams, participation, particularly participation as a research participant, was voluntary on behalf of the student athlete, and it was confidential.
Okay, thank you so much, Phil. So I was the Connect within the institution. So again, I'm the student services coordinator for SWAC. So I basically, when I was asked to be the mental health coach, we were ecstatic and to partner with Brock Athletics and CMHA. So that was really cool. We were thrilled, and again, this was kind of new for us. So it was basically just doing my job, but extending it. Kind of more specifically towards a demographic within the school. So student wellness and accessibility, also known as SWAC. We have 4 branches that I was able to support students coming our way. So student health services, personal counseling, student accessibility, and of course, health promotion on campus. I did provide a list here of what we do. We do way more than that, but this is most popular, how we support our students. Um, uh, in terms of data, I don't know specifically, but I can tell you now that during the fall of 2023, we did see a lot more athletes up here, which speaks volumes to this pilot project that we rolled out here. So we did see a lot of students confidently come up, wearing their bags and, sports gear. So, which is not something we see often. So it was notable to see that we were seeing athletes actually coming up here. And on occasion too, we did have one of the mental health champions show up too with one of their teammates. So that's again just super cool to see up here, seeing that we're reaching and this project is actually working, and they do talk amongst themselves. So we were able to support the student, and my role in doing so was to be the primary contact. Um, Triaging, doing the brief intake, getting to know the student, what we can do to support, doing the warm transfer, all of that encompassed into one service geared towards the Talk Today program. So in the intake, it was nice to see that the sports teams were talking to each other and getting everybody on board with this. And the 2 teams that were chosen in particular it was nice to see them up here. And I think that was my biggest takeaway, was seeing that these students are communicating and basically advocating for mental health on campus, especially on a sports level. So at the end of all of it, I think we'd love to see this continued work, and we're very proud of it. And I can't wait to see the data that will be presented to everybody shortly. Thank you.
Thanks so much. So our part in this partnership was historically, and Alex, if you want to just click ahead, CMHA Niagara has had a long and very successful partnership with Brock. We were involved in providing on-campus single session counseling support during the stressful times around exams in both the fall and the winter sessions. And based on that relationship, we were able to provide the support to connect Talk Today and Phil with the SWAC group, and that worked out really well. As Alex said, ordinarily when we are involved in Talk Today with the Niagara Ice Dogs and the Erie Otters, we provide the mental health champion and the mental health coach. In this situation, it made more sense to really drive the student athletes to SWAC to get that kind of support. And if needed, then certainly SWAC could connect the students with community resources. It was very gratifying. I attended the celebration event, and one of the student athletes just shared in conversation with me that her own experience with a SWAC therapist meant that she felt confident to engage with ongoing mental health supports in her home community. So it really speaks to me about never underestimate the importance of giving students this kind of awareness and accessibility, because it can plant seeds and make it way more doable for them to connect and reach out as they progress past their post-secondary engagement. One of our staff members was trained in the new Team Up curriculum. Historically today, Talk Today, rather, as Alex said, was using the assist training. And I think the beauty of the new Team Up curriculum is it is very much deliberately geared towards athletes, and a lot of the material is much more focused on interactions on the bus to a game or in a treatment session with a trainer, those sorts of things. So much more relatable for the athletes as opposed to the standard assist curriculum. So I think that's been a real boon for us to be able to use that training in this pilot. Our Awareness Day, and I want to say a big thanks to SWAC and Brock Athletics. We had the Badgers mascot attend. SWAC provided hot chocolate, and we had really good engagement with students, both athletes and just students from Brock U. We had pictures or signs where they could hold up and say what mental health meant to them. And I think generally from an awareness standpoint, I think being situated right outside of the cafeteria meant that we had lots of traffic and around the lunchtime. So I think overall it was a really successful Awareness Day as well. And I'm really glad we were able to participate in this.
Okay, so I can talk a little bit about the research. Before I get into it, I noticed there's one question already in the Q&A, and I can answer that quickly. And then if people have questions, if you pop them in there, we can answer in the most timely fashion. So Megan asked if all participants received the training or only select individuals. And Josh and Mishka might want to jump in a little bit more. I think the buy-in was, I mean, as Alex said, the workshop was part of the Talk Day program, which was a team-wide initiative. Athletes were not forced or coerced that they had to do this. They had the choice to do it. I know some individuals, because of scheduling, because they're student athletes and they're very busy, and it's hard to find a schedule that works for everybody, couldn't attend the session. But I don't think anybody didn't want to do it. I think everybody wanted to, and if it fit into their schedule, they definitely participated. Josh and Mishka were in more contact with the individual teams. I don't know if they have any more feedback on that they want to jump in with. And if not, I can go on and talk a little bit about the research. Oh.
I can say one thing, Phil.
Yeah.
There were some questions about the content of the workshop going into it, and so I provided some feedback. But I think if they were able to attend, most did attend. If they found some of them were maybe worried about the team setting in the beginning, but I don't know what the final count was at this point in front of me, how many people did buy in, but I think it was mostly scheduling, like you say.
Great,
One
thanks.
interesting thing, sorry, one thing interesting thing just quickly that I found was even when we were scheduling, like Mishka said, like there was some like hyper awareness maybe from the athlete about what the content might be. But I found more so for the athletes that couldn't make it due to any scheduling conflicts, a lot of them had reached out to me and asked if there's going to be a second date where they can go as well. So at least that's kind of a positive we can take away. If they weren't able to attend, there was a lot of interest in actually attending it. So that was very interesting, very nice to see.
Great,
Yeah,
thanks.
thank you. Thanks, Josh. Yeah, same thing for me. There was people that reached out and asked if they could take it again, for sure.
So if, Alex, if we can go to the next slide, perfect, thanks. This is just a summary again. Part of what we really wanted to do was a research study on the effectiveness of Talk Today, to provide evidence that could convince other partners, help Brock make a decision to expand the program, and we're researchers and we wanted to do some research. So this is just a simple flow chart that goes through the methodology that we had. We had 4 teams that came to us to participate in the study. We randomly chose among those 4 teams which would be assigned to the Talk Today program and which would be assigned to the control group. So we made sure that in the 2 sports there is in one sport, the male team participated in Talk Today and the female team was a control group. In the other sport, the female team participated in Talk Today and the male team was a control group. So it allowed us to compare between genders, between people that were in the Talk Today program, not the Talk Today program, and in between sport if we really wanted to. The individuals, the teams that were in the control group and not part of the Talk Today, that was not withheld from them. We've talked to them, given them the opportunity by the end of the calendar year, if they wanted to participate in the study, or if they wanted to participate in the program, we could definitely do that. So once we had set up those teams, what we had was a time frame that basically went through their full season as a varsity athlete. So we measured some outcomes, which we'll talk about in a sec, at the very beginning, kind of preseason baseline measures, the things that we thought Talk Today should have an impact on, and to see if we could generate any evidence on it. The second time we asked them to complete those questionnaires was after the team up workshop. Then when they did the team event, the community event, which is basically the end of their competitive season, we collected data again a third time. And then just a couple of weeks ago, which is about 6 months after the initial measurement, we asked them to complete surveys again. All these surveys, I'll talk about them in a sec. They were all completed online. Again, this is an example of how communication through athletics, through the coaches to their student emails with a follow-up reminder was a good example of the buy-in from the whole system. So what that enabled us to do was get a sense of certain outcomes. If Alex could jump to the next slide, certain outcomes of Talk Today. Was there an immediate impact of the workshop? Was there a long-term effect? Did they retain it 6 months later? And the things that we chose to measure were the stigma that they have with respect to help seeking. Would the Talk Today program reduce mental health stigma, help-seeking attitudes and help-seeking behaviors, mental health literacy, their awareness, their knowledge of mental health and the resources in the community. We had a measure of psychological distress, which kind of a screening measure that taps into well-being. I mean, it's not really a diagnostic tool for mental illness, but it's a screening tool that talks about self-reported indicators of things like anxiety and depression. And we've also measured demographics that would be relevant, like their gender, if they have previous experience or personal history or family history with mental health and mental health services. So what we have then is those 4 or 5 measures taken before they participate in the program, after they do the workshop, after they do the community event, and 6 months after the initial baseline. So we can get a sense of what impact we might see that Talk Today has on these various outcomes. So I've got a few results. We're going through the results now. I think the next slide, the first thing, so I presented them all these ways. This is the pattern across 4 time points. The lighter bar is the control group who didn't participate in the study. The darker bar is the Talk Today groups that participated in the study. I'll say a few things. First of all, we can get a sense of the trend of what might be happening here. We want to make sure that we keep, if you look at on the left-hand side, you get what the average scores are, and things that might look like they're great big differences might not be. It might be a matter of scaling. But this is a pilot project with relatively limited data, so it's nice to look at the trends. So with respect to psychological distress, and this is really people self-reporting in the past 2 weeks, their general level of anxiety, their general level of depression, with a really widely used scale. What we see is that the Talk Today group, as you go through time, there's kind of a dip by the end of the program relative to the control group. But overall, especially considering the scale, these scores all vary between like an 8.4 and the lowest one is about a 7.2. There's not a huge difference in it, so psychological distress may kind of wax and wane over the course of an academic term for a student athlete. We don't see any real direct response that I think is indicative of the impact of Talk Today. We do see some more promising trends in the other outcomes. So the next slide talks about mental health literacy. And this is a really interesting scale that talks about, how aware, how well informed are you about mental health issues? And one of the things particularly is resources in the community. So some of the questions might be how well informed you are about mental illness, but some of the questions talk directly into if you or someone needed help, do you know where you would go to get it? And I think this is quite interesting because what we see right at the beginning is that both Talk Today and the control groups are very, very similar level of mental health literacy. And then at the second time point, which is after the workshop, we see a big spike in it from the Talk Today program relative to the control group. And then at the last point in time, we see that change seems to be retained. I'm not going to talk about this in terms of statistical significance because there are issues with the data and the amount of responses we had at certain time points. But I think the trend is really encouraging. And what we see is what it appears is that individuals, and they're randomly assigned to the Talk Today program, so there shouldn't be that much of a difference between them and the control group. It's not like they volunteered for it because they were very motivated to understand mental health. But the Talk Today program, we see a spike relative to the people who aren't in it. That the Talk Today program, the Team Up workshop, seems to really increase their mental health literacy. And even 6 months later, in February and March, we see that seems like it's been retained, which is a really encouraging sign. The next outcome we looked at was stigma. Now, this is interesting, and I don't know why my color scheme has changed, but again, if we look at the range of numbers, there's not a huge difference. We're talking about between 2.5 and 2.7 on a 5-point scale. But if we look at the trend, and higher numbers in stigma here indicate a higher stigma. So the Talk Today group, what we see is a reduction in stigma after having taken the Team Up workshop, but we see a spike in it after, and then no difference at 4 points in time, at the 4th point in time. Now, these are not really big differences, but if we look at the trends, there does seem to be some kind of impact of the Team Up workshop. But there's obviously other things going on in these student athletes' life, like how stressful is their life, what other things might impact stigma between September and October for a student athlete, and that seemed maybe to counteract or overwhelm any effect of the Team Up program. So, we would like to see have some strong evidence that the stigma reduced and stayed reduced. We do have some evidence that suggests there's an immediate impact of the Team Up workshop, but again, it's with relatively small numbers right now because it's a pilot study. The next outcome we looked at was help-seeking attitudes. And this is interesting. We see really parallel lines between the Talk Today and the control group, and throughout it all, the control group actually had higher help-seeking attitudes. And that's just, I mean, these are randomly assigned groups that the groups, the two teams that happen to be in the control group for whatever reasons, maybe based on personal history, maybe based on other factors, had better or higher help-seeking attitudes. But what we do see over the course of the program is that gap gets incredibly narrowed. So by the time the program is over with, the retention that people remember from the Talk Today program, the Team Up workshop, that difference is totally disappeared. So, you know, the fact that there's a gap at the beginning that continues even after the workshop, there's things kind of outside the scope of the study that I'm sure would have impacted this, that we, you know, maybe the personal history might be a part of that. But the real take home message there, I think, is at the end of it, that gap has been narrowed. So I think that's the last results we have. We jump to the next slide. I can't remember if I popped in one on now. So what we see is, again, with some basic pilot study data, Brock is really supportive of this. Brock Sports really wants to see this continue and expand. And we see some evidence that, you know, I would have to kind of use finger quotes because the data analysis is not complete yet, but we do see evidence about how this might affect particularly help seeking and mental health literacy, which would probably be two of the primary outcomes we think student athletes would derive from this program. So it's promising, but it is preliminary. But one of the things in terms of next steps is, you know, this is a great discussion. We've had discussions like this in-house at Brock with SWAC, with Brock Sports, and there's definitely an appetite for this to continue. So I really look forward to this continuing as a partnership amongst all the bodies and to continuing the research there. I don't know, Alex, if you want to go through these potential next steps here, or you want me to comment on them?
I mean, if you want to comment, I could hop in after. Yeah.
Yeah, I just think, I mean, the number one take home message for me as the university prop who's interested in this is it's such a successful partnership. I mean, the Brock Sports is interested in it. The individual teams are interested in it. SWAC has been really supportive of it. Researchers, myself, and grad students are interested. CMHA and even MyTax as a funding partner. Like, it is an absolutely great example of a multiple partner partnership, and all partners are really happy to continue this and expand on this, which is great. The research component of it is really important, because anytime you want to have any kind of discussion with the stakeholders in the Brock community, with decision makers about where resources are going to go, with funding partners, I mean, evidence is going to be really important. So we've got some preliminary evidence, which is great. I mean, some of Jenny's commentaries about just the recognition of an increase in athletes coming in and using their resources is fantastic. You got some firsthand feedback on that, but we've got some kind of valid, reliable, hard numbers that are really going to be useful. So, I mean, going forward, there's a lot of things that we're looking to expand on. We want to try and spread this word to as big a community as possible. We're looking at opportunities to talk to the youth sports community across Canada, to the Coaching Association of Canada, whose coaches should be involved in these kind of projects. Just making sure if we've got a pilot study that is probably going to grow, that Talk Today's footprint in varsity sports in Canada is, you know, we're fully behind, going from that being a pilot study with a couple of teams at Brock to a lot of teams at Brock to a lot of schools in the OUA to a lot of schools from coast to coast. So we're really at an exciting point in that process right now.
Thanks, Phil. And I couldn't agree with you more. And I don't want to speak for Heather, but it's definitely been a tremendous partnership for us as well. And we're so excited about where this can grow and how, and the opportunities that can stem from the work being done at Brock University. And to your point, one of the biggest challenges is always funding, but research like this is going to be such a great driver to help us promote it and seek potential sponsors or potential donors who might want to support this work. And it's been overall an amazing experience for us, and we're really excited to see this research as well as this partnership continue to grow and expand across university sports across Canada.
I would just echo that the partnership historically between SWAC and CMHA Niagara has been just great, and it made it very easy for us to want to engage with Phil and Alex on this as well. And I also look forward to what the possibilities are.
I do see, so this concludes the presentation. I will stop sharing my screen.
Thank you so much, folks. I do see a few questions on our Q&A, and folks, feel free to add more questions if you would like. Maybe this might be a question for you, Alex. This one question from Samantha. I'm sure you will get into this later, but will there be an opportunity to engage athletes in minor sports as well? A limitation that I have seen surrounding safe sport and mental health intervention with athletes is that all the available mental health interventions that currently exist are only for older athletes and those that are participating at provincial and or national level. I'm concerned that this is too late. This is too late as I have children playing minor sports at an elite level and they are struggling and don't have dedicated supports in place aside from child mental health services.
And that's a great question, Samantha. And I'm really excited to tell you that we do work with some minor sports organizations. We've actually, in the past, some of our colleagues in the Sault Ste. Marie area at our CMHA Algoma there worked with the Sioux Female Hockey Association and worked with athletes anywhere between the ages of 8 all the way up to 18 plus. Oftentimes what we do is we tweak that education component for younger athletes. So the team up training that we deliver is actually catered to 15 plus athletes. What we do for younger age groups is we focus on sort of two different groups. We focus on sort of that 8 to 10 range and then 10 to 12 range. And at the 8 to 10 range, we do very basic sort of mental wellness and mental health education for the kids. The focus is more on kind of getting them just thinking about their mental health, giving them a basic understanding of anxiety, depression, like understanding that, you know, it's normal to have feelings. It's normal to get angry sometimes. It's normal to feel stressed sometimes, and just getting them more comfortable with their emotions. And then when we look at that 10 to 14 range, what we do is we start to dive a little bit, 12 to 14 range. We start to dive a little bit more in depth into understanding, you know, there's healthy levels of stress, healthy levels of anxiety that, you know, you can feel stress. It's a normal response, but when do those levels become unhealthy, and when should you talk to somebody, and encouraging open conversations about mental health and that sort of thing. And then when we get to that 15 plus, we focus more on suicide prevention aspect, and the skills you learn through our team up workshop, as well as through trainings like Safe Talk, are still very much applicable to recognizing any kind of struggles that somebody might be having. It's really making you more sensitive to the idea that if somebody's struggling, you're recognizing changes in behavior, and how do you speak with them directly, and if you think it's suicide, how do you ask directly about that and connect them with appropriate services. So the skills are sort of, in my opinion, transferable in a lot of ways to other mental health issues, but the key focus is on that suicide prevention piece, which stems from the heart of how our program initially started. So I hope long-winded answer to say yes.
Wonderful. There is a question in the chat asking about what we mean by, you know, specific needs and specific barriers that you see in varsity athletes.
Sorry, what was the question?
It says, can you comment on the specific needs and specific barriers that you mentioned that you see in varsity athletes? And this might be something for the rest of the group as well.
I think I can make a few comments there. I mean, briefly, what we see, I mean, obviously, university students as a group demographically, they're at relatively high needs for mental health support, and it's a stressful time of life, and student athletes are, you know, they're an intersection of that population, people, you know, 18 and 20 years old, and their relatively high levels of mental illness and lower levels of well-being, and relatively elite athletes who have special challenges as well. I mean, specific things that we see with respect to varsity athletes. I mean, there's barriers to there's the stigma of being an athlete and mental health help seeking. There's still a stigma against it in varsity sports. There was a study done on OUA, Ontario Sports, a couple of years ago, And we replicated it at Brock. And one of the questions was, has there been a time in the past year where you thought you needed professional help and you chose not to do it? And in one study, 50% said yes to that. And in a replication, 60% said yes to it. The reasons why, so that they would recognize a need, but as varsity athletes, they would choose not to. Part of that is the anonymity. There's great mental health services and campuses across Canada. But there's, if you're a varsity athlete wearing a backpack that says, rock lacrosse, if you are the 7 feet tall in the starting center for the men's basketball team, I mean, there's certain issues with respect to anonymity. There's issues with respect to scheduling. And there's barriers that they recognize that their needs are probably unique. If you are, if you're a wrestler and doing certain things to control your body weight, if you have issues with sleeping because of the schedule you follow as a varsity rower, sometimes the response you might get for someone who isn't attuned to those sport-specific needs and focuses it on a mental health issue is different and maybe somewhat dismissed by the athlete who would just, well, they don't get it, right? I have to be up at 4 o'clock in the morning to go rowing and I need to do a part-time job and that's why I don't sleep. But it doesn't mean there's not an impact on that lack of sleep. So, I mean, some of the needs are just elevated with respect to anxiety, depression, sleep disorders, and things like that. But the barriers tend to be very specific to the lifestyle of student athletes with accessibility, anonymity, and flexibility of services offered.
Thank you so much for that great response. Another question, just for clarification, someone's wondering if they heard correctly that the Safe Talk training was adapted to be more tailored to athletes.
So this is not an adaptation of the Safe Talk training. While I believe a lot of my colleagues would also agree with me, Safe Talk is an incredibly valuable training, and across the country, CMHAs across the country continue to deliver Safe Talk. This is actually a new training that we developed in partnership with our colleagues at the Center for Suicide Prevention in Alberta. And the idea behind this was working together to really develop something that was very athlete specific. We did an evaluation of the Talk Today program in the Ontario Hockey League as part of our partnership, and what we got was that Safe Talk training was incredibly valuable. The players appreciated it and used it, but mostly some of the feedback we received from the players was, this training is great, but can we have some more sports-related examples? Can we make it more sports-specific? So we partnered with our colleagues at the Center for Suicide Prevention to develop this new training. And another issue too with challenge for us with Safe Talk, especially with elite level athletes, was the length of time. So we were able to shorten the training to 2.5 hours from 3.5 hours, and we were able to make it more sports specific from a content perspective, to make it a little bit easier to implement with particularly those elite level athletes who have incredibly busy schedules, to Philip's point earlier.
Wonderful. And I think, Alex, you might have touched upon this, but one of the other questions here is if you can speak a bit more to the specific content that was included in the Talk Today workshop.
Yeah, definitely. So the team of training focuses on a couple of different components, but really what we've built it around is a 5-step model that we've created for players and athletes to better understand how to respond to somebody if they recognize signs that they're struggling. So we build up to that 5-step model. We begin with giving them sort of an idea of the communities, because when we look at how, particularly when we talk about our partners at the Canadian Hockey League as an example, and even on campus, they kind of exist within different communities. They have their sort of home community where they grew up, where everybody knows them. Then they go to play high-level sports, and they have sort of their sporting community that they closely work with, and then it's their school community. So the students that they're called, their fellow students who might not be athletes, but they're friends with and know them. And we kind of put it within this context when we talk to the athletes to kind of help them understand sort of their role within these communities and how their mental health can be impacted as part of this. And from there, we talk about sort of understanding protective factors, risk factors, and then we dive into a 5-step model for responding when they think when they notice a change in one of their teammates, and we want to give them the tools to respond if they think a teammate might be struggling, and where to get those supports.
Thank you for that. And then there's another question here in the chat asking, where can I learn more about the Team Up training specifics? What specific training do the team mental health champions receive? Oh, Alex, you're muted.
We do have some handouts I'd be happy to pass along, but we currently haven't put it up on our website. We piloted the program last season with the Canadian, or two seasons ago with the Canadian Hockey League, rolled it out, and then last year we had first developed this general sports version of the Team Up program. So we haven't gone too in depth into promoting the training, but you could learn more about Talk Today at www.talktoday.ca, and I'd be happy to share some handouts as well that we've created for some of our sports partners.
Thank you for that. I have a question, a personal question on my end, maybe for the research team. Out of curiosity, how did you assess stigma? Like, what kind of question were you asking when you were assessing stigma within the groups that you were studying?
Yeah, I mean, obviously it's a really important concept. I know if Mishka wants to jump in here, because that's one of the things I think she's got some good background in. But I mean, what we use is a specific scale that's used about self-stigma. So thoughts, I mean, there's different aspects of stigma, and self-stigma is about my thoughts about myself. Would I be a lesser person if I reached out for help to a mental health professional? There were specific questions like that. I think it was a 10-item questionnaire that's been widely used in various fields. That each would have items like that have been tested and proven to be pretty valid.
Yeah, you're right, Phil. I can read off some of the questions, some of the items if you're interested. So for example, if I went to a therapist, I would be less satisfied with myself. I would feel inadequate if I went to a therapist for psychological help. It would make me feel inferior to ask a therapist for help. And then there's some like reverse coded items such as my self-confidence would not be threatened if I sought professional help. I would feel okay about myself if I made the choice to seek professional help. So a lot of those type of questions phrased slightly differently tapping into confidence, self-worth. Yeah.
Wonderful. And then we have another question asking here, are there plans or is there interest in implementing or piloting the Talk Today in other post-secondary campuses in Canada?
There's definitely always interest. So if there's an opportunity, we're always happy to engage and connect. The way the program's structured is it is structured around our local CMHA branches. So normally what we would do is if somebody was interested in expanding the Talk Today program to their campus, they could reach out to me. I would help facilitate a connection with our local CMHA. And then we would have discussions around what Talk Today would look like within your campus. Because it can vary from campus to campus and branch to branch in terms of what resources already exist. And we don't want to duplicate efforts. We always want to take advantage of existing resources as much as possible. So similarly to the work we do with SWAC, having a great partner within Brock, we're able to utilize the resources they have to add value to the work that's being done to support these athletes. So it's always a possibility, and you're more than welcome to reach out to me. I could put my email in the chat, and happy to discuss further.
I would add quickly to that youth sports, which is the governing body of Intercollegiate Sports Canada, I've been in touch. I mean, this has been a great example of just some discussion and some outreach, and I've been in touch with them about trying to get something going with youth sports. They have a committee in youth sports on mental health and mental health research. So that committee is really well informed about this project and other projects. We're asking them to partner up on some kind of series of events like this going forward too. So in addition to individual campuses and individual champions wanting to speak out and connect with CMHA, the youth sports as a whole has a certain awareness that we really want to emphasize and keep them in the loop as much as possible.
Thank you so much. I do want to highlight one of our resources at CICMH. We do have a student athlete mental health toolkit. So I'm putting the link here in the chat for folks to check it out if interested. I want to be mindful of time, but we will go for one final question, and it is, how do you go about identifying athletes who are in need of further mental health support? So example, to connect with SWAC. For example, did athletes contact the researchers or contact the Student Wellness Center on their own, or were they identified based on their scores on the K6?
I think that's a really, really good question. And there's probably more than one answer there. Part of what we've done is, promoted a great community and a great avenue to seek help. Strictly speaking, through the Talk Today program, they would have someone on their team that is a mental health champion, that if they're feeling something, they can go talk to a teammate who is self-nominated that they want that role. And the team would have been in contact with a community mental health coach, like Jenny. So those things have been put in place. They do. I mean, part of participating in a research study like this, part of our responsibility is, as researchers, if something comes up that if we have encouraged something or provoked something that requires more help, they know that they can come to us. That's part of our responsibility as researchers too. And also, Brock Sports being involved in this as a pilot project, their involvement is much more than that. They are really invested in the supports that their athletes have for mental health. So there's one or two very specific obvious roles where they can go to. Who is the champion on their team? Who is the mental health coach for that organization? There's other things that they're aware of now, but they're maybe not as explicit. But Josh and Mishka and I have a role that if you were to get an email, hey, after filling out that questionnaire, I want to talk about something. We have a role and we have a place that we would direct them to as well.
Wonderful. Thank you so much. Oh, sorry, I saw you, Mishka. Would you like to add something?
I was just going to add, and Jenny, correct me if I'm wrong, but I'm pretty sure when we introduced the project and the Talk Today program, some athletes did directly reach out to you as the mental health coach too. So they didn't necessarily, you don't have to go through the champion, right, Alex? Like, you can go directly to the coach if that's available. So I think that also happened, which was great to hear, even before the workshop.
Yeah, the champion oftentimes, it's not, so the champion's usually a go between if somebody doesn't feel comfortable reaching out for support, or they forget the mental health coach's phone number, or they don't know who to reach out to, or they have any questions. Like we definitely encourage reaching out directly to the mental health coach, and it happens often because that anonymity aspect is something that's very big for some folks, and we want to make sure that there's sort of that third party outside of the team environment that somebody feels comfortable seeking support from.
Thank you so much. So I believe we have come to the end of our webinar. I do want to remind folks that you are able to access all of our recorded webinars on the Campus Mental Health .ca website. I'm just going to put all of the information in the chat. So I have included where you can access our webinars, our website in general, as well as our More Feet on the Ground course, which helps any non-clinical staff or students to learn how to identify mental health challenges in others, how to respond to them, how to recognize them, and how to refer folks to somebody who can help them. So there's a great free course, and you're welcome to share it among your networks. And I just want to thank our speakers here for a great and informative webinar. Thank you so much, and thank you so much for our attendees. And we hope to see you next month as well.
Thank you.
Thank you. Take care, everybody.
Thanks, everyone.